Well, welcome to episode 2 of Mastectomy 101. My name is Judy Fitzgerald, and I'm an 11-year breast cancer survivor. And I have been an advocate for the prevention of breast cancer since my diagnosis in 2009. You can read more about me and my background on my website at www.sisters4prevention.com. I also recently, in the past few months, began a podcast, which is on buzzspot.com, and that's also Sisters for Prevention Breast Cancer Resource Podcast. And thirdly, I have a book that's available on Amazon, and it's called A Teacher's Journey, What Breast Cancer Taught Me. This was written by myself back in 2010 after I completed my year of treatment. And it's available on Amazon, and all proceeds from the book go directly to funding breast cancer prevention research. So, why the title of Mastectomy 101? Well, in my responses to my podcasts and my website, it seems that most women that were contacting me through either venue were looking for more information about what it's like to journey through breast cancer with mastectomy as a treatment protocol. So I decided that since I was a teacher, I would look at this like a teaching project, hence Mastectomy 101. And what I'm going to do is in my videos share with you my journey through breast cancer, where it was necessary for me to have a bilateral mastectomy in 2010, and how I navigated that journey, why I made the choices that I did, and what recommendations or insights I learned, either through trial and error or from making mistakes, or by simply looking back on it and saying, I wish I'd known this back then. So I'm going to begin with telling you how my breast cancer was discovered. And let me start by saying that I have no family history of breast cancer. I'm actually the first one in my family to ever have been diagnosed with cancer at all. So in 2009, I went for my routine mammogram. My mammogram was always scheduled in December, right before the holidays, just because that's when I had my first mammogram, and as you know by insurance, you're only allowed one every 12 months. So I went for my normal mammogram, and I was excited because the Christmas holidays were coming up, and my sons were coming home for Christmas, and I couldn't wait. I was actually picking up my younger son, James, at the airport that evening. So nothing seemed abnormal. I went to my usual hospital and had the mammogram, which was prescribed by my local OBGYN, and everything seemed normal. So Christmas came and went, and about a week after Christmas, which was about 2 weeks after the mammogram, I received a call from the hospital, and they said, we need you to come in for a biopsy. And that right away threw me quite a bit, because honestly I had fibrocystic disease, and I used to dread having a mammogram because I was constantly being called back for more films because they couldn't get a clear picture of an area. And actually 10 years prior to that, after returning from an overseas assignment in the United Kingdom with my husband, I had a false alarm for breast cancer, and I actually had to have a biopsy at Dana Farber Research Institute, which proved to be benign. So I wasn't totally, I guess, naive as to how serious what I just been told on the phone was. Like, why would they say go right to a biopsy? So I questioned him. I said, well, don't you really just want me to come in to have more films taken? And he said, no, we would really think that it would be prudent to proceed with the biopsy. So sometimes the world throws you a curveball, but it also shows you a path. And unfortunately for our family, my sister-in-law Betty had been diagnosed with breast cancer just 2 months prior. And so she was being treated at Dana Farber, where I had been 10 years earlier for my second opinion. And there was no doubt in my mind that, again, I was going to go for a second opinion, because I thought if I was going to have a biopsy, there was no place I would rather have it. Judging by how it had gone previously, and also how I wanted to go to a place where everyone that was looking at my biopsy was just a specialist that looked at only breast cancer biopsies. So I was able to get an appointment about a week later, and previous to that, I was able to send my films on to Beth Ann Lesnikowski, who had operated on Betty and who would be my breast cancer surgeon. Sadly and very unfortunately, my wonderful surgeon who I'd had 10 years prior, Yvette Mattori, had succumbed to melanoma within the last few years. And she was an amazing woman, and actually a protege of Dr. Susan Love, as was Dr. Lesnikowski, and as was the nurse practitioner I would meet with, Karen Pollard Murphy. So I had quite a cadre come with me that day. I had my mom, my husband, my sister-in-law Betty, who also had an appointment, and my sister-in-law Maureen, who was accompanying Betty, but also offered to sit in with me as well. Maureen actually was key in setting me up with Dr. Mattori previously, and she was well familiar with the staff at Dana Farber, so it was quite comforting to have someone along. I always recommend you take at least one person along with you, or maybe two, if your spouse is someone who is so emotionally involved in the situation. Bring someone else who could take notes and can really focus on what the doctor is saying, because it's very difficult after the fact to revisit that in your head and really be certain of what was said. Luckily for me, I've been over this so many times with my notes when I was writing my book that I have a pretty clear picture of what that day was like. So Karen had me put on a gown, and she gave me a full examination of both breasts, which I was a little surprised about because the area of concern was microcalcifications in my right breast. Now, if you're not familiar with microcalcifications, so our breasts can have calcifications. They're white dots that appear on a mammogram, and when they're large, they're really not that much of a concern, but they're basically, specks. The primary purpose of the breast is to make milk, so the calcium deposits are there. But when they are microcalcified, which are like specks of dust, and they follow a pattern, particularly a circular pattern, that indicates that those cells are doing something that they shouldn't be doing. Karen called down to the radiology department, and she said, listen, this guy, radiologist that's on duty, is the one I trust with my own life. He does my sonograms when I have anything with my mammogram. I really would like you to go down and have him do a sonogram. I want to get a complete picture while you're here, since Dana Farber is about an hour and a half from my house, where I was living at the time in Rhode Island. And she said, while you're here, let's just get it done. So I thought, sure, see if there's anything big about that. So we proceeded down meanwhile, Betty went to her appointment, and my mom and my husband came with me down to radiology. So you all know the procedure. They gave me a gown, they made me wait in the room, and of course, by this time, my mind is going in a million different directions. And they call me in, And they started with the right breast, since that was where the mammogram had flagged an area. And I was watching the screen. Of course, I had no idea what I was looking at, but it looked to me just like, a lot of white dots and some sort of striated muscle tissue. And then they did the left breast. And to be honest, they both did not seem concerned at all with anything they were looking at. I not only had the radiologist that Karen recommended, but he was training an intern. And so I had two doctors, each with two sets of eyes, total of 4, looking at me. And I was watching the screen. Of course, again, I had no idea what I was looking at. And they said, well, we're going to have to call Karen because she wanted something specific and we're not seeing anything specific. So they went out of the room, and now my blood pressure is going through the roof. And they came back in and they said, well, Karen said to check 7 o'clock. And when you're diagnosed with breast cancer, you become very familiar with how the doctors look at breast cancer like a clock, like where the areas of concern are located. So he said, we're going to try again. So they put more gel, and of course they went to 7 o'clock on the left breast, which of course is toward the middle of my chest, and they didn't see anything. And then they pressed a little harder, and then I was looking at the screen. What appeared was a huge black hole. And I had no idea at that point that that meant that there was cancer there, but I knew it couldn't be good. And the look on both their faces kind of gave it away. And I looked at them and I said, I don't think that's good. And they said, well, Karen will talk to you about it. So I went out to my husband and my mother in the waiting room. By this time I'm shaking and I'm kind of about to lose it. And we get up to Karen and she said, well, we have some uncertain news for you. We don't know what's going on with the right breast. So of course that was expected that we would be doing a biopsy. But on the left breast, there is an area of significant suspicion. So we're going to have to biopsy both breasts. That was hard to hear. That was really hard to hear. So I'm not going to go any further than that today, but I am going to say that before I left there that day, I had 2 appointments. One for a stereotactic biopsy on the left breast, where they would actually take a piece of the area, and a needle biopsy on the right breast, where they insert a needle to the area with a mammogram to make sure that they are in the right area to take the sample, because again, there's no tumor there, there's no way of finding the area without a needle-guided mammogram. And I also left there with some Ativan, which was a little way of me getting through the next few days until the biopsy, and then of course the longer period where I would have to wait between the time of the biopsy and the final the pre-surgery pathology, which I will be discussing too. So please comment below and let me know if you have any questions on anything I talked about today. And in my next session, I'll be talking about what it was like to have the stereotactic biopsy as well as the needle biopsy. So again, thank you for joining me. Till next time, stay safe, stay well, and may God bless. See you later.